Welcome to week 2 of the Pain Management Programme Handbook. This is the second in the series of recordings of the Pain Management Handbook. The handbook opens by asking you to do a bit of a summary of the last audio handbook that you listened to, asking you to think about what did you learn. Take a few moments, maybe pausing the recording, to have a think about this. And then following this, think about what you're going to do, maybe differently or in addition to what you would normally do, based on what you've learned. Again, pause the recording if you need to. So moving on to new material, we start off by looking at activity management, pacing and the 3 Ps. Overactive/underactivity cycling, or boom and bust, as it could otherwise be called. Probably the most common behaviour that people report with chronic pain is going through cycles of overactivity and underactivity, also known as boom and bust. People with chronic pain can often push themselves too hard when they're having a good day, only to pay for it the next few days. This normally means they can have bad days and not be able to do as much. This is particularly difficult for people who work, as life seems to consist of work and bed, with very little energy left for enjoyable things. Over time, this boom and bust can lead to becoming less fit. The average activity reduces with boom and bust, so does the fitness and ability to do things. So on this page in the handbook, we also have a cycle with the words good day, leading to getting lots done, leading to stress on the body, leading to flare-up, leading to reduced activity, leading to that it takes time to recover, going back to having a good day, and shows that this is a cycle. There's also a diagram of activity levels. One shows that before chronic pain, our activity fluctuates a little bit, but on average we do similar amounts of things every day. But with chronic pain, we see bigger spikes of activity with long periods of time where we're not able to be as active in between. It can be a surprise to learn that it is not the pain condition that reduces ability, but the response to the pain, the boom and bust cycle, that reduces this ability. To help overcoming the loss of activity and the discomfort of the overactive and underactive cycles, there is a common method known as the 3 Ps that can be helpful. Now the 3 Ps stand for prioritizing, planning, pacing. That's prioritizing, planning, and pacing. So firstly, prioritizing is deciding what will be done and when. As people with chronic pain often suffer from guilt, they can be driven to do chores or tasks that someone else could do or that could be done at a different time. Think about what you need to do and what is really enjoyable for you to do. It is important to do things that are meaningful to you. You may even find that the pain is less intrusive if you regularly do things that you enjoy. So we suggest that you make a list and aim to, number 1, prioritize what you can do. Number 2, delegate what someone else could do. And number 3, drop what is not necessary and is not enjoyable. The next of the 3 Ps is planning. Having a plan is crucial to success. Often we can end up overdoing by not taking into account what an activity involves. You can break down a task and you can practice and prepare for a task. If you plan the task out well, you will very likely enjoy the task and also get a sense of accomplishment when you complete it. Note, to help plan, watch out for hidden parts of the activity. For instance, you may wish to go swimming as a gentle exercise. However, to swim, you need to prepare your swimming gear, getting to the baths, change, shower, get in the pool, actually swim, get out, shower, change, get home, wash and sort out your kit. The swimming only takes a small part of the overall time spent on the activity, so with planning you could prepare your kit at a different time. You could also improve your tolerance to travelling before actually starting swimming, so that overall the activity is less stressful. Now we move on to pacing. Pacing is very useful for people who have chronic pain. It allows them to stay active, avoid the boom and bust cycle, and have a predictable level of activity. This allows them to be able to commit to things knowing that they will be able to do them. In principle, pacing is very simple to understand. 1. Do an activity for a specific time and stop before it becomes too much. 2. When you stop the activity, either take a break or swap to a new activity. The new activity should not involve the same physical or mental effort. Don't do an activity that needs the same posture, for instance. The difficulty between this and what people normally do when they think they are pacing is stopping before the symptoms come on. This takes experience. If you do things until the symptoms start, you are training your pain system to feel pain when you are doing the activity. Psychologically, you are rewarding the pain by resting, rather than rewarding the activity by resting. The problem with pacing is that it is very difficult to do. When you are doing something, your brain can get a reward from this. This reward system can temporarily decrease your pain. This means you are less likely to notice that you are overdoing when you are doing an activity until the experience of pain outweighs the reward of doing that activity. Without teaching yourself to pace, you may find that you regularly overdo activities because of them. In the early stages of learning to pace, people find it hard to change the habit of pushing on through or stopping when they are not actually hurting. People report overdoing things because they're trying to keep active. They have family concerns, tasks to do for the family. They're worried about work or financial problems. Activity is enjoyable. Activity distracts from the pain. Or maybe that they like to finish the job or think that I've started, so I'll finish. Making the change to do good quality pacing is difficult. You'll need to learn to congratulate or reward yourself when you've done this well, so that it becomes easier with time and your reward system works for you. How to pace. Firstly, set a baseline, which we'll talk about later, or tolerances if you're using the effort scale. Take frequent short breaks. This involves changing posture regularly, for instance, swapping between sitting, standing, walking, and general movement. Break up tasks into smaller bits. If the whole task is too big, break it up into amounts that are manageable. For instance, do 3 trips to the supermarket each week instead of one large buy, dividing shopping into 2 bags of use instead of just using one. Gradually increase the amount you do to grade up. Plan to do a bit more each week. Each increase should be small and should not do more than you planned, even if you feel like it, avoiding the boom and bust cycle. The effort scale. The effort scale is a score out of 10 of how much overall effort an activity takes from start to finish. Whilst this is based on how you feel, it can be surprisingly effective and avoids the mathematics involved in setting a baseline. To use the effort scale, you simply score an activity out of 10 on how much effort it is. If your score is less than 5 out of 10, you can increase the amount you're doing. If you're scoring more than 5 out of 10, you can reduce the amount you're doing. To grade up with the effort scale, you simply note that the amount of a particular activity that you're doing that scores 5 out of 10. This is your baseline. Practice this over a number of days. When this amount of activity becomes easier, for instance, when it becomes 4 out of 10 on the effort scale, increase the amount of activity you are doing until it scores 5 out of 10 again. This new amount is called your tolerance. Gradually, you should see an increase in activity with this method. Tips to help pace. Don't compare yourself to others or what you used to be able to do. Try to accept where you are now. Grade up gradually. Increasing too fast can lead to a boom or bust, or even giving up an activity. Give your body time to adjust before grading up. It may be worth considering a certain day of the week as your review or grading up day. Keep a written record of your activities and the tolerances you are trying to increase. This helps you to see if you are making progress or slipping back. Signs of progress build confidence. Think about rewarding yourself. Signs of slipping back give an opportunity to work out why and is a useful learning exercise. Start with easier activities. For those activities you can't leave, take frequent, short rests. Breaks incorporating relaxation and stretches to ease the strain on your body. Try to change your position regularly. Move before the pain gets bad. Remember, it's okay to ask for help with specific tasks. Everyone does it. Keep your targets and plans as much as you can. 3P's activity worksheet. When looking at a task or activity, prioritize, plan, and pace. When looking at a task or activity, these are the sorts of steps you should follow. So firstly, ask yourself, does the task or activity need to be done? Or is the activity important to you? If the answer is yes, go on to the next question. If the answer is no, consider whether the task or activity needs to be done at all. So question 2 is, do you have to do the task? Consider this carefully. Can someone else do it? Sometimes we feel guilty saying no. Sometimes asking for help can be difficult. We may not trust someone will do the task the way we would do it. If you say yes to do you have to do the task, go to the plan section. If the answer is no, practice saying no. Practice asking for help. Be flexible and accept that another person will do things differently. You may need to take the time to plan with other persons or other people that you're thinking of that you might need to ask help from. So the planning section. What does the task or activity involve? For example, getting tools ready, preparing, travelling, doing the activity itself, travelling back, tidying up, etc. List the parts of the task. Remember, you will need to pace each part of the task or activity listed. If the task includes doing things with other people, try to include them in the planning. This may help things go more smoothly. You need to practice and gently grade up parts of the task before you can do the whole task successfully. Now we look at pacing. List the parts of the task or activity. This is an exercise, by the way. How much can you do before you need to swap your activity or take a break? Remember, you need to swap activity before the symptoms are too much or before getting to a point that you know you will pay for it later. So list the parts of the activity or task and then write what your baseline or tolerance levels are. How long would you be able to do before you need to take a break? And how many breaks will you take? Ask yourself, do you need to increase your tolerance to a part of the task or activity to make the whole activity easier? Obviously, go back and listen to parts of this section if you need more time, or make sure you go back and pause them if you want to give yourself the opportunity to think through for yourself. Now, we ask you to think of the whole plan. Write down the whole plan, including breaks needed so you can successfully do the task or activity. If on attempting the whole plan there is some difficulty, see which part of the activity is causing the difficulty and look again at your baseline or tolerance for this. So next, we have a diagram of the stages of change. The starting point of the stages of change is shown to be becoming self-aware, so that you can start to choose what you change. We then enter a cycle that starts with pre-contemplation, loss of control, pain taking the lead, feeling trapped, wanting to change. This then leads on to the next section of contemplation, planning your changes so that you get your personal needs met. This can be diverted off due to fear of change or the consequences of change, and you're back at the start waiting for pre-contemplation. But if you're successful in planning your changes to get your personal needs met, you can move on to active change, which involves putting changes into practice or gaining control. This is followed by maintenance, ongoing commitment to yourself to keep your choices. Now, this can go on to relapse, where we go back to old behaviours and then back to pre-contemplation again, or maintenance can move on to following your choices and accepting your limitations. Getting fitter and being more active. Why can being more active help you manage your pain? Well, it reduces your joint stiffness and improves flexibility. It stretches scar tissue and improves strength and stamina. It lifts your mood and helps you to relax. Helps you to do and achieve more each day. Exercise controls your weight and improves your body shape. It increases your bone density. It can improve your sleep pattern. It releases your body's natural painkillers, endorphins. It reduces your blood pressure and decreases risk of heart disease. And it can help to reduce depression. How does it do this, or how do we do this? Find a regular activity you enjoy doing. Taking a daily walk, even if it's only 10 minutes to start with. Using the stairs more often or walking uphill. Learning to relax between activities. Stretching and moving during household chores. Taking an exercise class of your choice. Doing exercises at home. Now, here's some myths about exercise. It has to hurt to do any good. Wrong. You have to be able to do a lot before you feel any benefit. That's wrong too. Exercise damages your joints. Wrong. Exercise will make your condition worse. That's wrong too. Exercise can make you tired. Wrong. You need special clothes. Wrong. Remember to find activities that you enjoy. If you can find something to do with friends or family, it will help to keep you motivated. What if my pain increases? Some aching after unaccustomed activity is normal for everyone. It will reduce after the first few times. Remember, hurt does not mean harm. Begin slowly and increasing the pace gradually. Make sure that you have comfortable footwear. Do little and often to start with. 2 shorter walks with a rest are better than a long one. Don't push yourself too far, too fast. If you can find an activity you really enjoy, the psychological benefit will outweigh any discomfort you may experience initially. When the feel-good factor kicks in, don't do more than you planned. Gentle warm-up and cool-down before and after exercising will help prevent injuries. Don't automatically reach for painkillers. Let your body adjust to increased activity naturally. Use an activity diary included in the pack to monitor progress. Remember to vary the types of activity, rotate household chores, find activities that you enjoy and reward yourself. Recognize and acknowledge your improvements. Get someone involved, maybe a friend or family member. Accept praise and compliments. Work on strength one day and stamina or flexibility the next. Your chronic pain management case manager or healthy lifestyles instructor will help advise you of the correct techniques. These are the people who work in gyms or may be involved in an activity scheme through your local leisure centre or run by your local organisations. Next in the handbook, there is an activity diary. It's listing every day of the week, Monday through Sunday, and asks you to write down something that you're going to do on each of the days. You can plan rest days, of course. This allows you to be as flexible as you need to be. It also asks you to maybe score how much you enjoyed the activity. Now we move on to stretching exercises. You can hold the stretches for as long as you feel able to. Do not hold them any longer than you need to. You can repeat them if you feel able to. To check you are relaxing, make sure you are not holding your breath when you are stretching. Right, let's get started with the stretching exercises. I will allow you time to do one stretch on each side, but you can pause the recording if you want to take more time to do this. We will start with a neck or shoulder stretch. With your shoulders relaxed, gently take your left ear towards your left shoulder. At the same time, gently pull your right shoulder down. The stretch should be felt around the top of your shoulder, between your neck and the tip of your shoulder. Hold this for as long as you feel is easily manageable. And then repeat on the other side. Next is a back of shoulder and shoulder blade stretch. Stretch one arm over to the opposite shoulder by gently pulling it at the elbow with your other hand. The stretch should be felt in the back of your arm that is being pulled across you, and possibly on the inner edge of your shoulder blade. Hold this for as long as you feel is easily manageable. Repeat it on the opposite arm. Tricep stretch. Raise your arm as if to touch the back of your neck. With the other hand, gently push your elbow backwards. Hold for as long as you feel is easily manageable. Repeat with the opposite arm. Next is a spinal rotation. Sit upright with your hips facing the front of the chair. Rotate your upper body, neck and head to the left. Gently aim to grasp the back of the chair with your right hand, but remember to keep breathing. Hold for as long as you feel is easily manageable. And now repeat to the opposite side. Next we will do some stretches in standing. Please make sure that you're in a safe environment and not in a position where you're at risk of tripping or falling. This is an upper chest stretch. In a walking position with one foot ahead of the other. Stand near to a door frame or the corner of a wall. Bend your elbow and support your forearm against the door frame or the corner of the wall. Gently move your hips forward and turn your upper trunk away from the arm until you feel a stretch in your chest muscles. Hold for as long as you feel is easily manageable. Repeat with the opposite arm. Just a note at this point, if there are any stretches that you do not think are right for you to do, that is okay. These are just ideas of exercises and are by no means the best exercises for everybody. But please have a think about it before you give it a go and only do what you think is right for you. Again in standing, the next exercise is a calf stretch. Lean towards a wall with your feet about a small stride back from it. Place one foot in front of the other with both feet facing forwards. Keep both heels on the floor, or as best as you can, bend your front knee, keeping your back knee straight. You should feel a stretch in the calf on your back leg. If your front knee goes beyond the ends of your toes, stop and place your rear foot a little further back. Hold, again for as long as you feel is easily manageable. And repeat with the opposite leg. The next stretch is again in standing. And as I mentioned, please only continue with it if you feel it is right for you or is within your capabilities. Stand, holding onto a firm support. Bend one knee and take hold of the ankle, or if you can't reach, put a towel around the ankle or hold onto your trouser leg. Do not lock the knee of the leg you are standing on. Gently draw your heel towards your buttock, straighten your hip so that the knee points towards the floor. This is the knee of the leg that you are holding. Stretch should be felt on the front of your thigh, but you may also feel it a little in your back too. Repeat on the opposite side. The next exercise is done sitting in a chair. Place one leg straight out in front of you with the other bent a little. Lean forward, keeping your back straight towards the leg that is out straight. The stretch should be felt on the back of your thigh, on the leg that you are reaching towards. Hold for as long as you feel is easily manageable. And repeat with the opposite leg. You can also do this exercise in standing. In this case, stand with one leg out in front, or perhaps on a raised footstool or step, keeping your knee straight with your weight over the other leg. Now bend your upper body forwards from your hips, keeping your back straight. And again, the stretch should be felt on the back of the thigh of the leg that you are reaching towards. Repeat on the opposite side. Again, a reminder that to only do stretches or exercises that you feel safe to do. The next exercise is performed lying on your back. Lying on your back, gently draw one knee towards your chest. You might use your hands to support it in place. You can also use a towel if you can't reach. The stretch should be felt in your buttock. Hold for as long as you feel is easily manageable. And repeat with the opposite leg when you feel ready. You can do the same exercise in sitting. To do this, sit upright with one leg crossed over the other. If you're able, gently draw the upper leg of the leg you wish to stretch up towards your chest with your arm. The stretch again should be felt in your buttock. Hold for as long as you feel as easily able. and repeat on the opposite side. One other way you can do this exercise in laying is to use your other leg at the same time. To do this, lie on your back with both knees bent. Cross one leg over the other, placing the ankle of this leg onto the opposite knee. Drawing underneath your leg towards your chest will start to make the stretch more difficult. You can assist by holding behind your thigh, and you can use a towel if you can't reach. The stretch should be felt again in your buttock and maybe in around your hip too. Hold for as long as is easily manageable. And repeat on the opposite side when you feel ready. Latissimus Dorsi stretch. Sitting in front of a table, you slide your arms away from you and across your table, leaning forward with your head and chest resting on that table, keeping your bottom on your chair. Hold for as long as you feel is easily manageable. You can do the same exercise on the floor if you are able to do so. If you want to try this kind of stretch, you need to be able to sit onto your heels, your hands reaching away from you and on the ground. Stretch your arms away from you and elongate your trunk. Keep your chest and head relaxed down between your arms, and again hold as long as you feel is manageable. You can stretch your back simply by lying on your front, and again holding for as long as is manageable. You can make this a more challenging stretch by bending your back upwards, supported with your arms. So lying on your front, arching your back upwards to lift your head towards the ceiling, using your arms to support you. Hopefully you have found some of those exercises useful. As I say, please only do the ones that you feel are appropriate and right for you. We now move on to goal planning exercises. I would encourage you to pause the recording in between each of these questions. I would encourage you to spend some time thinking about them and maybe record them whichever way you feel is best. So the first question is, what are the 5 basic values in life that are most important to you? Examples might be friendship or health. You do not have to record 5 if you think that there are a smaller number that are just as important to you. The next question is, what are your 3 most important life goals? These might take into account the values you've just recorded. What would you do if you had 6 months left to live? Is the next question. How would you change your life if you became an instant millionaire? What activities give you the greatest feeling of importance and satisfaction? What would you like people to say about you at your funeral? What have you always wanted to do but been afraid to attempt? Next, we're going to consider some things you might spend time with in your life. I'd like you to think about how long you spend on this and how long you would like to spend on it. So the first is family, but not marriage or parenting. The next is parenting, work, recreation or fun, community, citizenship. Marriage or intimate relationships, friends, social life, education or training, spirituality, health and physical self-care. You might need to go back and listen to that again, or pause in between each section and think about as to how important each one is to you. In your mind, or in whichever way you feel is best to record them, grade each of the above values in order of importance. Now, with these values and things of importance in mind, you can make some planned actions, or what we might call goals. We encourage you to keep track of how you are working towards those goals after you've made a plan that makes sense to you. Find some way of recording whether you've achieved them to allow you to move forward to work on further goals and things that matter to you. To help you work towards these goals, we now ask you to think of a list of problems, thoughts, feelings, memories, sensations, or other health-related issues that could get in the way of you achieving your targets. Pause the recording here so you have time to think about it. You could also think of a list of solutions, actions that you can take to get away from the problems that you've just thought of. Again, please pause the recording to give yourself time to do this. The battle between living the life you want and protecting yourself from pain. The previous exercise has helped you to identify the values in your life that are most important to you. You may find that you have an internal battle going on between the things you would like to do and attempts to avoid pain. For example, your valued action, the thing you would like to do, may be to return to work. However, your pain protection attempts may tell you that you need to get rid of the pain first, because you wouldn't be able to concentrate or cope with the job. This can lead to pain suffering, where you don't do the things you would like to do because of the need to protect yourself from pain. It seems reasonable to take care of pain before moving forwards, but if your pain does not change or go away, which we know it doesn't always, you stop moving towards the things you value in your life and increase your suffering because of pain. Have a think about how these struggles have affected your life and maybe record them. I'm going to go through a format in which you can do so. So first, think of a valued action, a thing you would like to do. And then think of a pain protection strategy. This might be thoughts about pain or avoiding pain, or an action you take to avoid pain. And then think of a pain suffering. This is things you've not done because of your pain, or things that have continued to happen because of trying to protect yourself from your pain. Perhaps pause the recording here and go through the 3 categories again of valued action, pain protection, the thing you do to protect yourself from pain, and pain suffering. Do you feel ready to change the way you have managed your pain condition? We've talked about goals. Humans are goal-orientated creatures. It's how we thrive. Having something to work towards gives us a feeling of motivation and determination, and achieving goals is a surefire way of building confidence and a sense of achievement. Setting goals will obviously be an important part of your plan for pain management. By setting and achieving goals, you will have something to work towards, and signs that you're improving in your ability to manage your condition. Often the reasons that people fail to meet their goals is because they set themselves a goal that is too big, too unrealistic, or too vague. Using the acronym V-SMART goals, we will help you to establish goals that are far more likely to be achieved. Incorporating values into your goal planning will help you to ensure that you are traveling in the right direction and that you're going to stay motivated. So V-SMART goals stands for values, what it is that the goal will help you to achieve in the long term, and why is this goal important to you. S is for specific. What is it exactly you want to achieve? Do you need to break it down into smaller steps? How are you going to do it? 3 is measurable. How will you track your progress? A is for achievable. Given the constraints of the real world, will you be able to do this? R is realistic. Can you actually do what he's proposing? Will you need help? T is for timed. What time period are you going to do it over? When are you going to do it? And for how long? Here's a case example. Sally has the goal of, I want to lose weight, because her doctor told her it might be a good idea to help with her general health. Since she is starting to lose weight by dieting, she reports that she has eaten more chocolate and has gained 3 pounds. How do we make this into a V-SMART goal? Firstly, make links to values. Sally's daughter is pregnant, and Sally knows that being overweight is putting her health at risk. She wants to be able to support her daughter and play an active role in looking after her grandchild. 2. Specific. How much weight does Sally want to lose? How does she plan to do it? M for measurable. How is Sally going to track her weight loss? A for achievable. Given the constraints of the real world, will Sally be able to do this? R for realistic. Can Sally actually do what she's proposing? And timed. What time period is she going to do it over? When is she going to do it? So Sally's new goal based on these principles is, I want to lose weight so that I can live longer and actively help my daughter and play with my grandchild. I'm going to lose 1 to 2 pounds every week by eating fruit instead of chocolate and getting off the bus 1 stop early on the way home every day to walk. I'm confident that I can do this because it's summertime and I'll measure my progress by weighing myself every week. I will talk you through a structure in which you can use to reflect on these kinds of ideas and approaches. Maybe have a go at filling it out. Look at your goal. You might already be feeling a sense of anxiety or a feeling that you won't be able to do it. We know that in the real world things get in the way and that achieving our goals might mean putting up with some difficult feelings or sensations. Aspects of mindfulness practice can actually be useful here. See if you can sit with the discomfort of the sensations that are arising in relation to your newly set goals. Is there anxiety? Is there doubt? Is there self-criticism? Is there potential embarrassment or pain? These feelings are normal. Within this approach, see if you can feel the discomfort, but weigh this up against the projected happiness, sense of achievement, or well-being you would achieve if you did the activity? What would you be willing to endure? By focusing on your values, you can start to move towards your goals, not by belittling or trying to get rid of the anxiety or doubts, which after all are there to protect you, but by accepting the feeling of these, accepting they are okay, and committing to take the first steps towards your goal as your values are important. So if you are thinking of doing some Be Smart goals, maybe create the following areas in your mind, or if you're able to record them. So firstly, think about your values. What is the direction you are wishing to move in? Next, think of a draft or a vague goal. What is it you are hoping to achieve? Now we can use the SMART template to give us some ideas about how to move towards that draft or vague goal. Firstly, pick a specific goal. What do you want to do? Be as precise as you can. Measurable. How will you know when you have made a change? Measure time, distance, or repetitions, for instance. Achievable. Can this be done with the current abilities or resources that you have? R for relevant. Given your values and your long-term goal, does this activity actually help you in the way you would like it to? Timed. Set a time you expect to get this done by. Think about the obstacles. Is there anything which will get in the way? And solutions. What will reduce the effect of the obstacles that allow you to flow around it? It might be a good time to think about your long-term goal, what it is you'd like to achieve in the longer term, and try and keep this important in your mind. Take care not to set up a difficult physical goal and a short time scale, otherwise you may end up overdoing. Look again at the section on graded exercise for example. Achieving long-term goals take time. It is not uncommon to set goals that can last over a year. To do this, the long-term goal needs to be broken down into a number of short-term goals. So, like using a ladder that you can climb one rung at a time, you can break your long-term goals into small, easy, short-term steps. So you might repeat the exercise described before, or you could follow this other goal tracker. Think of a long-term goal. Think of roughly when you would like to achieve it by. And then think of the small or V-SMART goals, so like we've just discussed, that would need to be done to reach your longer term goal. Finally, in this recording, we're going to go through the body scan meditation. This is a form of relaxation or meditation. Make yourself comfortable lying down on your back in a place where you will feel warm and undisturbed. You can lie on a mat or rug on the floor or on your bed. Allow your eyes to close gently. Take a few moments to get in touch with the movements of your breath and the sensations in your body. When you are ready, bring your awareness to the physical sensations in your body, especially to the sensations of touch or pressure where your body makes contact with the floor or bed. On each out breath, allow yourself to sink a little deeper into the mat or bed. To set the appropriate intention, remind yourself that this will be a time for falling awake rather than falling asleep. Remind yourself as well that the idea here is to be aware of your experience as it is unfolding, however it is. It is not to change the way you are feeling or to become more relaxed or calmer. The intention of this practice is to bring awareness to any and all sensations you are able to be aware of, or the lack of sensation, as you focus your attention systematically on each part of your body in turn. Now bring your awareness to the sensations in your belly, becoming aware of the changing patterns of sensation in the abdomen as the breath moves into the body and as it moves out of the body. Take a few minutes to feel the sensations as you breathe in and as you breathe out, as the belly rises on the in-breath and falls on the out-breath. Having connected with the sensations in your belly, now bring the focus or spotlight of your attention down the left leg, into the left foot, and all the way to the toes. Focus on each of the toes in turn, bringing a gentle, interested, affectionate attention to be with the sensations you find. Investigate how they feel. Perhaps noticing the sense of contact between your toes, a sense of tingling, warmth, perhaps numbness, whatever is here, perhaps even no sensation at all. If that is the case, it is all okay. If in fact, whatever you are experiencing is okay, it is what is there right now. When you're ready, on an in-breath, feel or imagine the breath entering the lungs and then passing all the way down the body, through the left leg to the toes of the left foot. On the out-breath, feel or imagine the breath coming all the way back from the toes and the foot, right up through the leg and torso and out through the nose as best as you can. Continue breathing in this way for a few breaths. Breathing down into the toes on each in-breath and back from the toes on each out-breath. It may be difficult to get the hang of this. Just practice this breathing into as best as you can, approaching it playfully. Now you're ready. On an out breath, let go of the toes and bring your awareness to the sensations in the bottom of your left foot, bringing a gentle investigation and awareness of the sole of the foot, the instep, the heel, noticing, for example, the sensations where the heel makes contact with the mat or bed. Experiment with breathing with and any of the sensations, being aware of the breath in the background, as in the foreground. You can explore the sensations in the bottom of the foot. Now allow the awareness to expand into the rest of the foot, to the ankle, to the top of the foot, right into the bones and joints. Then take a deeper and more intentional breath in, directing it down into the whole of the left foot. And as the breath lets go, in the out breath, let go of the left foot completely, allowing the focus of awareness to move into the lower left leg, the calf, shin, knee, and so forth in turn. Continue to scan the body, lingering for a time with each part of the body in turn. The left shin, the left knee, the left thigh, your right toes and foot and ankle, the right lower leg, your right knee, your right thigh, your pelvic area, groin, genitals, buttocks and hips, the lower back and your abdomen, your upper back and chest and shoulders. Take some time to do this now. Then we move to hands, usually doing both at the same time. We rest first with the sensations in the fingers and thumbs, the palms and the backs of both hands, the wrists, the lower arms and elbows, the upper arms, the shoulders again, your armpits, your neck, your face, and then the entirety of your head. Again, give you time to explore these different places. We'll wait for you to get back. when you become aware of tension or of any other intense sensations in a particular part of your body, you can breathe in to those sensations in the same way as you can to any others. Using the in-breath, gently bring awareness right into the sensations, and as best you can, have a sense of what happens in that region, if anything, as each breath lets go and releases on the out-breath. Your mind will inevitably wander away from your breath and your body from time to time. That is entirely normal. It's what minds do. When you notice it, gently acknowledge it, noticing when your mind has gone off to and where it has gone off to, and then gently return your attention to the parts of the body you intend to focus on. After you've scanned the whole body in this way, spend a few minutes being aware of a sense of the body as a whole and of the breath flowing freely in and out of your body. It is also very important to remind yourself that if you, like most modern people, suffer from low-grade chronic sleep deprivation, since the body scan is done in lying down, it's very easy to fall asleep. If you find yourself falling asleep, you might find it helpful to prop your head up with a pillow, open your eyes, or do the practice sitting up rather than laying down. That brings us to the end of the second recording of the Pain Management Program Handbook. We will continue in the third recording. Goodbye.